friends, welcome back to the Tooth Fairy Tales, the magic behind dentistry. I am the Light Dental Studios Tooth Fairy, and today I have a very special guest with me, Dr. Jordan Collins. Welcome, Dr. Collins.
Thanks for having me.
Of course. So you guys, some really fun facts about Dr. Collins is that he was voted best kid-friendly dentist in the state of Washington. That is quite a big deal. Also, Dr. Collins, one of his favorite things in high school was theater.
In high school, I was part of our high school musical. We did a production of The Wiz, and I was one of the gatekeepers to Oz, as well as numerous other chorus spots. And I always went to musicals with my mom growing up.
I have asked Dr. Collins to explain to us something today that is really important. We've all been in those emergency situations where somebody, maybe a little friend or a big friend, bumped their teeth. And we want to know, what do we do at home if we can't get to an emergency room or to a dentist right away?
If you bump your tooth, please go to your mom or dad right away and share this video with them so that we can help. We got a couple awesome tips to help out. Mom and dad, it can be very nerve-wracking when this happens to your child. Most commonly what's going to happen in a younger child is that the tooth may be actually pushed up. I have a lot of parents that will come into our practice and it can be a little bit concerning because all of a sudden the tooth is actually displaced a little bit. One of the things that you can do, please contact your dentist right away. If you can't do that, some really good home tips for you would be to have a child have a popsicle or something. The nice coldness can be very soothing on them. Depending on their age, using some sort of anti-inflammatory like children's Motrin can really help a lot. One of the really important things, whether or not it's just a mispositioning of the tooth or there's actually a break, is that time can be of the essence. So all of our offices at Light Dental Studios will have an emergency number that you can contact. That often goes to one of our cell phones. One of the things that you can do is if you're seeing a little red dot in the center of the tooth, that is very important to get to a doctor right away because it can affect the vitality of the tooth moving forward. If a tooth is actually mispositioned, say this is an older child of yours, please try to reposition it and then again come in right away. In the worst case scenario where the tooth actually comes out, say we're at a sporting event, wrestling match, and we catch an elbow or something, it's very important, if you can do it, to calm your child and try to actually reposition the tooth yourself and then come in and see us right away. If for some reason that's not able to happen, whether or not that's your child or whether or not it's just something that you don't feel comfortable doing, it's very important to keep that tooth clean and intact. So one of the things that we want to do is often if the tooth is dirty, it's really important to try to wash it off, but only for a short period of time. Water can actually be kind of damaging to the tooth. So we've got a couple different tips for you. There's actually a solution. If you're at a sporting event, most likely there's first aid there. They're going to have a little container of something called Hank's solution. That's the perfect thing to put the tooth in. In the absence of having something like that, milk is actually a really good thing to do. What's really important, again, is to not store the tooth in water. Do not scrub it or do anything of that nature. If you can, you actually want to grab the tooth by the enamel and place it in milk. If you don't have any of those things, you can actually hold the tooth in your mouth between your cheek and your tooth until you can get to a dental practice. If you have a really little one and you're worried about them swallowing the tooth, have them spit into a cup, or even you yourself could spit into a cup and store it in saliva. So those are really great ways to transport it. When you get to the dentist office, things that you can expect is that they will try to get your child comfortable and we will replant the tooth. Things to look out for moving forward is in the event that the tooth actually comes out, you will for sure probably be needing further treatment. In the case where the tooth just is mispositioned a little bit, it's something that we need to monitor over several weeks. So things to look out for on your own at home is that tooth will discolor. It often will start turning to kind of a gray darkness. It's another reason to go see the dentist right away. If you notice any swelling or redness above the tooth, that's also a reason to go in right away.
Thank you so much, Dr. Collins. Now that we are all done talking about what we do if we bump our tooth in an emergency, now it is time for some fun. And today, we're gonna make snow. Since it's January, I thought it'd be so fun to play with some snow indoors because here in Washington, we don't have any snow yet. We need baking soda. We need any kind of conditioner. If you are really sensitive to fragrances or your little ones are sensitive to fragrances, try to find a conditioner that is fragrant free because it is very smelly in a good way, but if you're sensitive then you might not like it. We have sparkles and we also have these fun marbles that we wrote the alphabets on, because we're gonna also make it a sensory bin so the kids can find their alphabets. We have two helpers today, Miss Ellie and Miss Tenley, to help us make snow. All right, girls, are you ready? Yeah? Okay. Now that we're all done making snow and we learned something new today, if you guys are interested in seeing Dr. Collins, he sees patients, both kids and adults, in the Lacey Hawks Prairie office in Washington. So go ahead and give him a call. And friends, don't forget to keep brushing, flossing, and smiling.